The FDA is examining possible side effects linked to obesity drugs, including reports of suicidal thoughts, alopecia or hair loss, and inhalation of stomach contents. An update to the agency's adverse event reporting system said that it was evaluating the need for regulation for these drugs, including Wegovy, Ozempic, Mounjaro, and Zepbound, that are connected with those possible side effects. The labels for GLP-1 drugs already list suicidal thoughts as a possible risk. Joining us right now to talk more about the FDA's probe and the new direct-to-consumer model that Eli Lilly launched this week is former FDA Commissioner Scott Gottlieb. He sits on the boards of Pfizer and Illumina and is a CNBC contributor. And Dr. Gottlieb, let's talk this through, the risks of what potentially could be side effects for these drugs. I think we've all been kind of waiting to see, is it as good as it sounds? Something that takes the weight loss off, a magical cure, a magical pill. How concerned should we be about these potential side effects?
This is an early stage investigation by the agency. So these are events or reports that came into their adverse event reporting system, their post-market reporting system, which comprises reports sent in by doctors, reports collected by the company, as well as spontaneous reports generated by consumers and data that they gather from payer databases and from some post-market surveillance that they do, including some monitoring of electronic medical records. So these are fairly routine, getting these kinds of post-market reports. That said, it doesn't surprise me that you're going to see an increase in reporting related to these drugs as more people use them and as a broader, healthier population and more diverse population starts to use these drugs. Whether or not these side effects that have been identified in the post-market monitoring are related to the drug needs to be evaluated. That's what FDA is going to be doing. They're going to be looking to see if there's a causal relationship. Are these side effects related to the drug? Are they incidental and just being detected in the background? Or could they be related to the actions of the drug? For example, the weight loss that's being achieved. Could somehow dramatic weight loss that's achieved by these drugs instigate alopecia, for example? Those are the kinds of things that FDA is going to be looking at. But again, I wouldn't be surprised to continue to see these kinds of reports come up. And I wouldn't be surprised if over time the labels of these drugs start to reflect a higher incidence of some of these kinds of side effects as a much larger and broader population uses these drugs. That doesn't necessarily mean it's going to change the risk-reward of using these medicines, but this is why we have an aggressive post-market surveillance system.
Yeah, inhalation of stomach contents. That sounds disgusting, but I was thinking about it. If part of the drug's effect is to slow motility and it makes you feel fuller because you are fuller, it doesn't digest your stomach contents as quickly, I guess that would make sense if something happens.
Right. There were reports of aspiration. So,
right.
Again, you're exactly right. It could be related to the mechanism of the drug in that instance.
Here's the question. You said that risk-reward scenario is still the most important thing to be looking at. And I think that's probably the key. The idea that somebody who is morbidly obese can be on these drugs and it can give them a healthier life is probably worth the risk of some of the side effects. My concern with these drugs has always been that they're being used in off-label prescriptions. They're being used for wider uses. They're being used for cosmetic purposes. Somebody who wants to fit into their skinny jeans again. How do you manage the risk-reward scenario under that sort of a situation?
Yeah, look, I think it's inevitable that there's going to be some inappropriate use on the margin. I suspect that it's much lower than we think right now. I think that a lot of the inappropriate use, the more cosmetic use, is just very visible because we see it on TikTok and we hear about celebrity reports of people using these drugs. But the payers have really clamped down and made it hard to get, or harder to get access to these drugs if you don't qualify based on your BMI or other comorbid risk factors. I think for the target population right now, people who have diabetes, people who are overweight and have risk factors related to obesity, certainly patients who have severe cardiovascular disease and maybe have suffered a heart attack or stroke and are overweight and can use these drugs to try to reduce their weight and get better control of their blood sugar. These drugs can really provide a substantial public health benefit. We saw the data that came out last year from the Novo studies looking at the substantial reduction in cardiovascular risk related to use of these drugs in that population, patients who have established cardiovascular disease. There's going to be inappropriate use in the margins. I suspect it's, again, much lower than we think. There's a supply constraint on these drugs, and the payers are making it difficult to get access. Cash pay patients will get access to it.
When you say the payers, you mean the insurers. And what we heard from Lilly yesterday sounded like an end run around the insurers, where they're going to drop the list price and try and make it so you don't have to go through PBMs or insurers.
Yeah, look, still expensive, even though they're dropping the list price. This is only for patients who are underinsured or uninsured. They're providing some incentives in the market for patients to get access to these drugs. If they don't have insurance or they're underinsured, it's still going to be quite expensive out of pocket. That's not going to preclude some people from using it and some people from using it in a cosmetic fashion. I think with respect to the telehealth, at least that Lilly set up, they seem to have taken care to try to provide oversight over that. It's very hard for a drug maker to set these programs up because they're going to be subject to the FDA regulation on promotion. So they got to put in place measures to make sure doctors can't aren't paid to prescribe it, doctors can't promote it, that any promotion that goes on has to comply with FDA regs. So you saw Lilly say things like the telehealth providers that they're using are going to make sure that patients have the access to the full complement of weight loss options and aren't going to be steered to one drug over the other, although within the telehealth mechanism that they set up, the Lilly product is going to be shipped for free, whereas other products will presumably be shipped for a cost. So there's going to be an implicit inducement there. It may be one reason why Lilly went to two smaller telehealth providers to do this. They went to a company called 9am Health with respect to their diabetes offering, and then a company called Form Health to provide the drug through telehealth, the weight loss drugs through telehealth. And one of the reasons they may have done that, and I'm just speculating here, is because these smaller providers, and these are two companies that were financed in Series A financings just in the last 2 years, the smaller companies may have been more willing to give up some of the potential upside of things like promotion to get the Lilly business.